Good afternoon, everyone. So today there are active participation of sports by most of the people. The youngsters are getting most into the sports, and that's the reason if you are actively participating, the injuries are also going to be common. We call them as sports injuries. Now, while treating a sports injury, it is also very important to know that you are not just giving the conservative treatment or you're just not controlling the pain and symptoms of the patient, but our ultimate target is to make that athlete or patient return to play. Now, I'm not going to discuss about the RTP protocols today, but yes, on field or off field, be it both of them, we have to take certain protocols if we are giving the phase 1 treatment to any athlete or a sports person. Hello everyone, my name is Dr. Shikha. I'm a sports and exercise medicine physician and I have done my MD in sports medicine from Sports Injury Center. So let's talk about it. Before moving forward to any of these three protocols, I want to give a quick review on what basically happened when any injury happened to any particular person, be it a normal sports, be it a national level or an international sports, or be it a recreational sports. A person is a person, injury pattern would always be same. So okay, any kind of injury it would happen. What we gonna do? I am going to talk about the time the patient is coming at us and patient is coming to us inside the OPD, or maybe you are present off field as well. So you have to make a diagnosis. How you would make it? You have to examine the patient. So clinical assessment of the patient is most important thing whenever any injured athlete or a patient comes to you. Now what does that clinical assessment would do? It is basically going to make a provisional diagnosis. So provisional diagnosis simply means that yes, you are expecting that this patient might suffer a ACL injury, this patient might be having a ligament sprain or maybe a fracture or a dislocation. But how you would confirm this diagnosis? You have to confirm this diagnosis by means of certain investigations. What are those investigations? Now in sports, the most important one are the radiological investigation. You go for x-rays, you go for MRI, you go for CT, be it anything. The most initial investigation of choice in all the case would be x-ray, because you have to rule out a bony injury, you have to rule out any avulsion fracture that is being involved over there or not. You had made a diagnosis, but you should be almost very proficient in this particular thing, because most of the time when you are traveling with the team and you are present off field, this investigation is not being present at a very immediate level. So you should be very efficient in at least making a provisional diagnosis so you can start with a management. Now, management can involve a conservative management and a surgical management. Now, in most of the sports injuries, even the sports person also want not to go for the surgical management. But yes, a failed conservative treatment and where there are no chances of giving a conservative treatment, where there will always be the diagnosis or the treatment of choice would be surgery, you always have to go for the surgical management. But yes, in both of the case scenario, the post management is also very important. That what you are aiming for, you are aiming for recovery. Obviously, you are aiming for recovery, be it you are going for a surgical management or a conservative management. You are going for the recovery of what? Recovery of ADL. That means activities of daily living. Patient should be able to walk pain free. There should not be any swelling. The range of motion should be complete. There should not be any disuse atrophy. The muscles should be equal and comparable to each other, even though in the power as well. So activities of daily living are very important. Now I have also added the another step, which is a loading protocol. That means you are progressively now loading that particular area which is being injured. Now I also have made a arrow line in this area because sometimes this loading protocol can be an earlier step than the recovery of ADL, because when we are talking about the loading protocol, we usually call it as optimal loading protocol and progressive loading protocol. It simply means you're loading the joint from the very basic level and you are progressing of the different phases. So sometimes what happens that on the initial phases only, we have start with the early phases of this loading protocol. Patient may discover and patient may develop recovery of their activities of daily living, and then you can add on to strengthening protocol in this phase. And then if you have added on to strengthening protocol a progressive loading protocol, what it's going to do, it is basically our second aim is the reconditioning of fitness of that person. A sports person or any person who is aiming at fitness, who had sustained an injury, you cannot tell them to go take a bed and do the rest for this amount of months. No, you have to aim on these things. You just cannot give them few groups of medicines and tell them to just stay at your home and not to follow any regime. It's very important to go for it. And then lastly, the restoration of their sports skills. Obviously, any sports person, if it comes to you, even if it is a badminton player, a basket player, a football player, what they want to return to play and they want to get back to the field as soon as possible. So restoration of the sports skills, and you have to make sure that re-injury won't happen. Now how would you do that? They can go outside, they can go on field, and then the re-injury can also happen. So when you are making a diagnosis, there is also third thing that comes, which is very 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 important, to take a proper history. And what actually you want to take, you want to have the thorough idea about the aggravating factors that has caused the disease, the biomechanical abnormalities, or any faulty anatomic variations. Now what does that mean? Supposedly, if a player comes to you and they said that I have sustained this injury on field, you have to ask about the intensity of the training. You have to ask that whether you have increased the volume, whether the playing surface is going fine or not, and whether you are giving too much of you into the sports and you're not putting yourself into the recovery. It is aggravating it. Whether you are not having a proper sleep, a nutritional diet, etc. You're going through certain sort of stress and you are not able to deal with it, so it is going to have the aggravating effect on the injury itself. The biomechanical abnormalities, it could be anything which is related to your body. My body is like my arm is straight, but sometimes what the biomechanics, my repeated playing or the overuse injury can create a muscle imbalance that can lead to the biomechanical abnormalities. And lastly, faulty anatomic variants. The most perfect example of it is the flat foot. I think 80% of the populations are suffering from it. They know that they are having flat foot, but yes, it will never cause you problem unless until you are going to do any kind of activity, and that could be an aggravating factor which can cause pain on that region where you're having a flat foot, or maybe any other region, maybe in a knee, maybe in a hip, maybe anywhere around the body. So this is how you need to deal when you are actually dealing with a patient who had sustained an injury till the time you are making them return to play. Now we will be going to discuss about these three protocols, which is very important. But before that, I want everyone to know that whenever we are dealing with the sports injuries, it's just not the case that we only have to give a medications to an athlete, but we also have to focus on the entire process, and we always have to keep the athlete in the loop.